the overview of the kidney and the structures, starting with the most outer layer here. This is the capsule, coming all the way around the capsule, and then two regions inside. The cortex, all of this is cortex, and then all of this inside that is called the medulla. So if I ask a question about region, this would be the medulla, and this would be the cortex, and of course the outside would be the capsule. Now structures inside the kidney include these pyramids. These are pyramids. All of these are pyramids. And that's where the functional unit of the kidney is, this nephron, which I'll go through in greater detail. But in between the pyramids are the renal columns. So here is a renal column, here's a renal column, here and here. And so inside that, it accommodates the passage of blood vessels that start out from the renal artery, the segmental artery, the interlobar artery, the arcuate artery coursing over the pyramid, and the interlobular. Interlobar, interlobular. Between them is the arcuate. Now, when urine is formed, it drips down through these tubules into the minor calyx here, and each of these is a minor calyx. The minor calyces merge to form a major calyx, and the major calyces merge to form the renal pelvis. So all of this here is renal pelvis, which terminates as the ureter. However, from here, and including the renal artery and the renal vein, is the hilus. Hilus, pelvis. Okay, now, inside these pyramids, which is what this represents here, you can begin to see some of the vasculature in more detail and the nephron. So, starting with the vasculature, this is the interlobar, just the same as this one, passing up in the column. It courses over the top of the pyramid to become the interlobular. Interlobular here, interlobular here. The interlobular gives rise to the interlobular, interlobar, interlobular, here. And that's going to give rise to the afferent arteriole. The afferent arteriole, I'm going to jump to another look at that. The afferent arteriole here is still heading into the glomerulus, and the efferent arteriole is exiting. It's narrower in diameter. As a result of that, this vascular tuft here, which is the glomerulus, has many capillaries, about 50 of them, increasing the surface area for filtration. So as blood and plasma enters into the glomerulus, the pressure inside forces filtrate to be formed and enter into the capsular space. The capsular space is between the visceral layer, which is on the glomerulus proper, and the parietal layer, which is inside Bowman's capsule. From the intercapsular space, filtrate now flows into the proximal convoluted tubule here. In addition, we have the distal convoluted tubule portion shown here, showing us the macula densa, and this is the juxtaglomerular cells next to the glomerulus, juxtaglomerular, next to the glomerulus, juxtaglomerular cells producing renin. So let's take a little bit more detailed look at the tubule network as it comes off of here, which is what I'd like to use this model for. Now, as a reference point, I just want to highlight the blood vessels. Here you have the interlobar and the arcuate. So the arcuate is coursing over the top of the pyramid, like an arc. That's the same blood vessel as this. This is the arcuate artery, arcuate vein, giving rise to the interlobular. The interlobular here, the interlobular here, just so you know where we are as a point of reference. Again, this is the afferent arteriole, which is the same as this, leading into the glomerulus. The efferent arteriole exits and is narrower. This is an efferent arteriole. It's giving rise to peritubular capillaries, and also notice down here the efferent arteriole gives rise to vasa recta. So these are the vasa recta blood vessels. These are the peritubular capillaries, and that's the arterial and venous side of the nephron. Now let's take a look at the tubules, starting with the Bowman's capsule. So there's Bowman's capsule. Filtrate enters from the visceral layer into the capsular space, into the proximal convoluted tubule. Remember, in discussing the limbs, the proximal means closer to the point of origin. My humerus is proximal to my shoulder, and my femur is proximal to my hip. Similarly here, the proximal convoluted tubule is proximal to the capsule. Now, once we get into the proximal convoluted tubule, and on this model in orange is where most of the absorption is going to take place. So what was once inside the plasma has now become filtrate. It's going to exit the proximal convoluted tubule, enter into the interstitial space, and now enter into the peritubular capillary. What remains behind travels down the descending limb, which becomes the thin descending limb. So now we're switching over from recovering all the filtrate to just exclusively collecting water, or predominantly, in the thin limb. Remember, squamous epithelium is flat. It's designed for absorption, filtration, and in this particular case, osmosis, which is the movement of water across a selectively permeable membrane. The ascending limb, which is now thick, the distal convoluted tubule, and just as a reference point, notice that the distal convoluted tubule is right between the afferent and efferent. Notice that the distal convoluted tubule is right between the afferent and efferent. The distal convoluted tubule becomes the collecting duct in yellow, where many, many distal convoluted tubules enter. One enters here, 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 all along the collecting duct. The collecting ducts, of which you can see that there are two here, become the papillary duct. And right here, the papillary duct ends, as it ends here, to drain into the minor calyx, major calyx, renal pelvis. Then, from the renal pelvis, the urine, which is now formed, travels down the ureter. So it enters into the bladder posteriorly. These are the ureteral openings, these little slits here, and between these two slits and the internal sphincter is the trigone. So you see this triangular shape area here is the trigone. This is rugae inside the bladder. It's made of transitional epithelium, and this is the detrusor muscle here. Now at the base of the bladder you have an internal sphincter muscle, and this is the male model, so beneath it you have the prostate. This is the prostatic urethra. When we look at the reproductive models, we'll continue on in both male and female from the internal sphincter to the external sphincter, where urine exits the body by way of the ureter. Did I forget anything? I didn't forget anything? Okay, just as a quick and easy. Afferent arterial, larger in diameter. Efferent arterial, smaller in diameter. Glomerulus and visceral layer, capsular space, and parietal layer. What color is this? Pink. Everything pink is a proximal convoluted tubule. Remember, there's a million of these in each kidney. So here's a proximal convoluted tubule, there's a proximal convoluted tubule. Then we have the distal convoluted tubule, whatever color that is, making this a distal convoluted tubule, this a distal convoluted tubule, this a distal convoluted tubule. The yellow collecting duct, yellow collecting duct. So it's essentially the same. Proximal convoluted tubule, distal convoluted tubule, and collecting duct. Glomerulus, visceral layer, capsular space, and parietal layer here. And we're going to do this again next week in lecture.